Imagine this for a second. You at the doctor's, right? And they're writing you a prescription. But it's not for some fancy new drug. It's actually for something you might, well, already have in your nightstand drawer. What if a really common personal device, one usually just thought of for pleasure, actually had, proven health benefits?
Welcome to the Sex Science Podcast, where we turn the latest peer-reviewed research on intimacy and sexuality into fun, accessible conversations. Generated by AI and fact-checked by experts, the Sex Science Podcast was created by LaShaw to empower you through knowledge. So, join us as we explore pleasure, relationships, human connection, and everything in between.
Today, we're diving into a really fascinating systematic review. It really challenges how we think about a device often kept, behind closed doors. Sexual Medicine Reviews asks, is it actually time for doctors to prescribe vibrators? And what's really important about this review, its whole mission, was to gather up all this existing data, which was kind of scattered all over the place, on the health benefits of vibrator use. It wasn't just like general curiosity. They specifically wanted to understand the impact on sexual function, pelvic floor function, and chronic vulvar pain. It really frames these devices as a potentially underutilized but actually quite crucial treatment tool, something that could genuinely improve women's lives.
And that's exactly why this conversation feels so vital. We're bridging this topic that's often considered, taboo with serious evidence-based medical research. It's a discussion that, frankly, feels overdue, and it challenges quite a few of our assumptions.
Okay, so let's dig into the core issue here. Why are vibrators considered underutilized in medicine? What's the knowledge gap this review is trying to fill?
Well, the main problem really boils down to a lack of knowledge within the medical community itself. Most physicians just aren't routinely trained on the potential medical benefits of these devices.
So naturally, that leads to less discussion with patients. And as a result, vibrators often aren't even considered as part of a treatment plan, even when they might be really helpful.
Right. It's like a tool sitting there, but nobody knows how to use it, or maybe even that it can be used that way.
Exactly. It's a classic case of being overlooked due to, a lack of awareness and education.
And I suppose it doesn't help that a lot of the information out there comes from commercial companies, the ones selling the devices.
That's a fair point. While that info isn't necessarily bad, the commercial context does highlight why we need solid scientific studies to separate the marketing from the actual medical facts.
So this review really tried to provide that rigor.
Absolutely. And they used a strict systematic review method. They started with a huge number, like 586 articles initially.
Wow.
Yeah. And then they narrowed it right down to 17 original studies. And these studies had to specifically focus on women, vibrator use, and how it applied to the pelvic or genital area. So this isn't just anecdotes. It's a really careful look at what the science actually says.
Got it. So with that solid foundation, let's start unpacking the findings. Maybe start where people might expect sexual function, but dive a bit deeper. What did the review find beyond just pleasure?
Well, it's definitely true that vibrators are widely accepted for enhancing sexual experiences. The review mentioned a survey, I think it was around 3,800 women, and 53% had used a vibrator. And of those, most used it on the clitoris, about 84%, and 64% used it intravaginally. So, common usage is confirmed, but the medical side goes deeper.
Right, and this is where it gets really interesting physiologically. How does vibration actually work? It's not just surface sensation, is it?
No, not at all. It's actually quite complex. Vibration actively helps with vasodilation, basically, widening blood vessels.
Okay.
This increases blood flow significantly in the pelvic floor muscles. It also helps stretch the muscles, boost metabolic rate, and improves tissue perfusion.
Perfusion, so getting more oxygen and nutrients to the tissues.
Precisely. And all of that together leads to less muscle tension and more relaxation. And there's a nuance too. Using intermittent vibration, like on and off during early arousal, seems to increase blood flow even more consistently than just leaving it on. It has to do with balancing the body's fight or flight and rest and digest responses.
That's fascinating. So it's actively changing the physiological environment down there. What were the specific measurable benefits reported in these studies?
They found pretty consistent improvements. For arousal, 82.5% of women noticed increased pleasant sensation during intercourse, and about 68% reported better vaginal lubrication.
That's significant.
Yeah, and crucially, even women who started with diminished sensation saw significant ongoing improvement over time. Then for orgasm, vibrator use was shown to decrease the time it takes to reach orgasm and also help facilitate multiple orgasms. There was one really remarkable finding, part of a larger treatment approach, where 93% of 500 women who previously couldn't achieve orgasm were able to with vibrator use.
93%. Wow.
It's a huge number. And beyond that, vibration was linked to increased desire, overall satisfaction, better sexual function generally, and less sexual distress. Even things like having positive beliefs about using a vibrator or a partner being accepting correlated with higher satisfaction. So it really touches on multiple aspects of sexual well-being.
Okay, so clear benefits for sexual function. But the review also looked at something maybe less obvious, pelvic health. Many people aren't even sure what the pelvic floor does.
That's a really important point. Estimates suggest maybe 30% to 50% of women don't actually know how to consciously contract their pelvic floor muscles.
Right.
So just quickly, think of it like a supportive hammock of muscles at the base of your pelvis. It holds up your bladder, uterus, bowels. It's crucial for urinary control, core stability, you name it.
Makes sense. So what did the review find here?
Two main things stood out. First, pelvic floor muscle strength. One randomized trial actually found intravaginal vibratory stimulation was better than intravaginal electrical stimulation for improving muscle strength. Statistically significant difference.
Better than electrical stimulation. Interesting.
Yeah. And also, commercially available vibrating Kegel balls got positive reviews for helping with incontinence, which shows some, real-world perceived benefit too. Second, for urinary incontinence, especially stress urinary incontinence or SUI, that's leakage when you cough or sneeze, using a vibrator as part of treatment significantly reduced leakage. One study showed a 77% reduction after 4 weeks and an amazing 92% reduction after 6 weeks when vibration was added to regular pelvic floor exercises.
The 92% reduction. That could be life-changing for someone with SUI. And how does it work? Is it just about making you aware of the muscles?
It seems more direct than that. One study suggested applying vibration to the perineum or clitoris could actually trigger the strongest pelvic floor muscle contraction.
So it directly engages the muscle.
It seems so. Now, we should be careful. Some studies combine vibration with other things like manual therapy or heat, making it hard to isolate just the vibration effect.
Okay, fair enough.
But there was one randomized controlled pilot study that specifically looked at a vibrating Kegel device plus exercise, and it showed improved SUI and muscle strength, suggesting vibration can actually speed up the results you get from exercise alone.
So it could be a booster.
Potentially, yes. The practical takeaway is that vibrators could be a useful tool for managing mild incontinence, maybe preventatively after pregnancy or during menopause when things can change.
Okay, shifting gears slightly, the review also touched on chronic vulvar pain, or vulvodynia. What did they find for pain management?
Right. Vulvar vibration therapy, or VVT. It basically uses the pain-relieving properties of vibration itself. In one study on women with vulvodynia, 73% reported improvement in their pain. 74% had increased sexual enjoyment, and 83% were satisfied with the treatment overall.
And were they comfortable with this as a medical treatment?
That's a key finding.
Yeah.
90% said they were comfortable with their doctors offering this.
Yeah.
Really shows patients are open to it, even if doctors aren't discussing it yet.
That 90% figure is telling. It suggests the barrier isn't necessarily patient discomfort. So does this open doors for other pain conditions too?
Absolutely. You could see how this might help women with vaginal scarring and pain after cancer treatments, like pelvic radiation.
Ah, okay.
Doctors often recommend vaginal dilators then, but they can be, intimidating and uncomfortable. Maybe a vibrator could improve circulation, ease pain, and make using those dilators more manageable. It could also potentially benefit patients with vaginismus, that involuntary muscle spasm, or genitopelvic pain penetration disorder.
How so?
Just because vibrators are often more familiar, maybe less clinical feeling than traditional dilators. Easier to approach.
And there's a practical side too, right? Accessibility.
Definitely. Vibrators are generally less expensive and easier to get hold of than a lot of specialized medical devices or treatments. That makes them a more equitable option for many women.
So wrapping this up, what's the big picture here? This deep dive into the review really does challenge how we think about these devices.
Yeah, I think the summary is, even though the review acknowledges the evidence level is currently considered weak. Mostly surveys, cohort studies, only a few randomized trials.
Right, needs more research.
Exactly. But despite that, there's a strong suggestion of positive effects across the board: sexual function, pelvic floor health, and managing chronic pain. It's a consistent signal in the data.
Which brings us back to that central question. If the benefits look this promising, why aren't doctors routinely recommending them, or at least talking about them?
And it loops right back to the start. That lack of physician training and, frankly, comfort level in discussing these devices is still a huge barrier. It just highlights a really clear need for more awareness, more education within the medical field so providers feel equipped to have these conversations.
Yeah, the evidence is building, the conversation needs to catch up, and the review itself calls for exactly that. More good quality research is needed to figure out how best to integrate vibrators into treatment plans for pelvic floor issues.
So maybe a final thought for you listening. Considering these potential benefits and how accessible these devices are, how might things change if we had broader acceptance? If vibrators were discussed not just as pleasure items but as legitimate medical tools, what stands out to you from all this? And how might you maybe approach this topic with your own doctor now, knowing what the research is starting to show? Something to think about.
Thank you for listening to the Sex Science Podcast brought to you by LaShaw. We hope that you learned something new about the wonderful world of human intimacy and sexuality, and join us next time as we dive into more fascinating research. And remember, science is for you. Music for this podcast was produced by SOUNDRAW.